Thank you really from the bottom of my heart for allowing me the privilege of being with you at this meeting, which is tremendously exciting. The progress that one can feel and the leadership that is coursing throughout this room is in itself a remarkable motivation for all of us as we take on the tough issues that are the reality of today's life in many places. It's an extraordinary privilege for me to be here for the third time in 3 years. And each of those events, the launch of the Practical Playbook, the celebration of the Build project, and today's focus on bringing public health and primary care together has grown, not only in numbers, but in the extent to which the celebration of your energy and your potential and the realization of that potential is really fabulous. It's a privilege also for me to be here by virtue of my association with the National Academy of Medicine, previously the Institute of Medicine, which has played a small role with the 2012 report on public health and primary care. And that's one of the nice things about being at the academies is being able to be associated with reports that can help provide a launch pad for people who are already poised to make an extraordinary difference in the world. So again, thank you very much for the privilege of association and for the privilege of joining you here today for the wrap-up of the Practical Playbook conference. I'd also like to make it very clear that I don't have any Bitmojis. I'm very envious of Karen's capacity in that respect. I didn't see it, but I heard about it, and I want one. Is that a proper term? One? The way in which her presentation was described, actually the way in which several of the presentations were described, I think is the embodiment of the kind of energy and creativity in this room. And it makes me sorry that I wasn't able to be here through the whole session because the dynamism that's reflected in the kinds of presentations, the creativity of those presentations, it gives us all cause to be optimistic as we move forward. I'm told that your meeting had, in addition to wonderful keynotes throughout the course, extraordinary set of breakout sessions in which the discussions ranged across the waterfront, generating different terms. Is that, if I'm understanding correctly, the World Cafe was so productive it yielded 3 times as many suggestions in the course of the session as any other session that had been held. And I can't wait to see the results of that. The discussions around the way in which collaboration can actually take place, grow, and be sustained over time. You even had a toolkit, meeting in a box, that Denise gave me a little preview of as we were having lunch. That's really fabulous. And of course, the notion that I gather coursed throughout all of your discussions was the importance of data to make the case. When it comes right down to it, there's no more important lesson than that. because when the potential and the mandate to make a difference has moved so clearly to the community level. We have a big tent with the Affordable Care Act. We have a big tent with the policy environment that at the national level. But what's now clear is that there isn't going to be progress without totally changing the dynamics at the community level. And I think that's why I sense so much dynamism in this room, because everybody in this room realizes that, and everybody in this room is going about the business of making sure that those kinds of changes and that kind of leadership happens, and that you're pulling together the data and information necessary to provide the rationale and the guideposts for the progress in which you're engaged. So, Brian, I assume you're going to be pulling together some of the key lessons from the meeting, because I certainly am going to be staying tuned for them, and will be looking forward to using them throughout the course of the next several years. My task today is to talk about sustainability. And of course, that's always the challenge as we look to the opportunities for progress. We want to make sure that they're not just short-term gains, that in fact we're laying the foundation for progress that will endure not just for months or years, but for generations. And it has to, because we all know how far short of our potential we are. And so let me just talk a little bit about sustainability and what it takes. Clearly it takes science. You've been talking about that throughout the course of your meeting, and we have plenty of science now. We certainly have a lot more science than we had when I was in medical school, and my professor said, well, chronic disease is just an inevitable consequence of the aging process. People just get sick and die of these chronic diseases. Clearly, we now know that there is a vast amount of controllability in the diseases that are afflicting people around the world. And not just chronic diseases, but infectious diseases. And we know that the tentacles of those problems course well beyond the clinical arena. And we know that, in fact, the clinical arena, while it is vitally important if we are ill, has relatively little influence on the overall health of a population. And that's why, clearly, individuals who, by virtue of their commitment to primary care, to serving as the health agents for the people for whom they're caring, know that they have to have strong ties outside the clinic door if they're going to enhance the prospects of people who are confronting challenges from their environments, from their social circumstances, from their absent to the right support systems that can help them improve the behavioral choices that they make. Science is very strong now, but obviously not strong enough, because despite the fact that in the last 30 years, the science base has really exploded to give us a much keener insight on the challenges and a much keener instinct on the way in which those challenges have to be addressed, we're still not making the progress that we should. And indeed, as we all know, at the community level in many communities throughout this nation, the trends are going in the wrong directions. So we should be celebrating the science, but not until we are sure that that science is being directed to application against the problems that confront our neighbors. So it takes science. We have science. Science is not enough. It takes necessity, a feeling of necessity, an understanding of the inexorable link between primary care and public health. It is absolutely necessary, and we all understand that. For us to achieve what can be achieved for health improvement, to have that link between primary care and public health be very strong. We can't manage chronic diseases, or we can't take control of infectious diseases without primary care and public health essentially intertwined. It is a necessity that we understand quite clearly. So we have science, we have the understanding of the necessity involved, but that's still not enough because the shortfalls are intolerable. It takes technology as well. And we have technology, we have tools that have developed to improve our ability to understand, to diagnose the prevalence of risk factors, whether they're individual or community. We have the tools of information technology that provide our capacity to bridge public health and primary care digitally. That's not a capacity that we had even 20 years ago. So we have that theoretical capacity to work seamlessly as a system. We have the emerging technology of around mobile health and the ability to reach not only between primary care and public health, but to individuals who represent the clients of the public health and primary care communities. So we have technologies that are developing that are very impressive indeed, but it's not enough because we don't have interoperability. What we have at this point in our wonderfully potentiated digital infrastructure is unfortunately a data avalanche that is pretty chaotic. Cacophony is probably a better way to describe the state of play with respect to our information infrastructure. The potential is there, and we all understand it. We all see it. We all use it in small ways. But without that interoperability, without that focus on ensuring that this kind of capacity has friendly and practical user interfaces, it's not enough. So we have science and we have necessity and we have technology. We obviously also need funding. And we have funding. That is, we have money. There's a difference between money and funding. We have a $3 trillion healthcare system. And yet nearly $1 trillion of that $3 trillion is wasted, pure and simple. It does nothing to improve the health of the population or any individuals within it. That is a vast resource that has to be turned to benefit. We have an indication that that vast resource can be used for benefit. With the Affordable Care Act, we have the notion of accountable care and accountable communities. And we have the CMS CDC initiative on pay for success that you heard about in the course of your meeting. This is all hopeful, but still, they're hints of what's possible, and hope in this case is not enough. We need to make sure that we're doing all we can to set up the structures for the use of those funds that not only provide the incentives, but ensure that the way we devote our resources is directed to improving the health of the whole population and of every vulnerable individual within the population. So science, necessity, technology, money are here, but they're not enough. Culture is obviously another important tool in our tool chest, and we have cultural changes that can work on our behalf. If we go back to the beginnings of our democracy, de Tocqueville was marveling about the strength of our creativity, of our local initiative, of the tradition of a community focus. So we still have that spirit about us, the power of the locality to make a difference, but obviously we're far short of harnessing a culture that is predisposed to local initiative and local creativity and local action to effect the kind of changes that are necessary. So we have plenty of science. We have plenty of understanding about the necessity of the issues at hand. We have plenty of technology. We have plenty of money, inadequate funding to the right places, but the money is there. And we have cultural trends that at some level are moving in the right direction and that hold the potential for unleashing substantially greater capacity. But it's not enough. Science, necessity, technology, money, culture, not enough. The fundamentally important ingredient is you. It's what you will do in your communities to make a difference. A few days ago, I had the occasion to be rearranging some of the books on my bookshelf to try to make room for the great products of the Practical Playbook Coalition. And I came across one that was written by my good friend, Al Sommer. And one of the great advantages and privileges of being of a certain age that you have a collection of friends who are really extraordinary. Three of my friends are staunch leaders in the public health community who are truly giants for health and medicine. They include, of course, Al Sommer, and Bill Fagey was referenced earlier, and D.A. Henderson, who took me to India with the smallpox program. These are really extraordinary people. So it was a small book. It wasn't a tome. So I thought, well, I should reread this. And I opened it up, and it's called 10 Lessons in Public Health, Al Sommer, published 2 or 3 years ago. I hope some of you have read it. If you haven't, you should pick it up. But the short of it is that Al Sommer's 10 lessons in public health are applicable, even though he was writing about his experience in Bangladesh early in his career and how it changed the way he approached things and how it shaped his life in many ways. The lessons that he has called upon 40 years later are applicable to us today and to you today. And the 10 chapters that he has here are entitled, Go Where the Problems Are, Get Into the Field, Forget the Job Description, Don't Count on Things staying the same, Follow most but not all the rules, Collect good data even if you don't yet know what important questions they may answer, Remember your humanity, Use data to set policy, If you think you're right, keep pushing, and take the long view. Now, I know that each of you in this room can relate to at least one of those, and probably most of you can relate to all 10 at some level, both from personal experience and from watching programs play out in your lives. Going where the problems are is obvious. You can't engage an issue unless you're there. For Al Sommer, his take was that he arrived at where the problems were serendipitously. He was coming of professional age when the draft still existed, and he was sent by CDC, where he ended up with serving his service responsibility in Bangladesh. It was serendipity in his case. But it was serendipity because nonetheless, it took him to a place with severe problems, and it forced him to think very differently about the approach to problems. So one has to be there on the scene in order to truly understand the kinds of challenges and to begin to develop creative approaches. His second lesson is clearly directly related. Get into the field. You know, our president, Barack Obama, certainly viewed that as an important part of life and learning when he worked as a community organizer in Chicago very early in his career, right out of law school, working to understand what it was that was shaping the problems and the solutions in the neighborhoods of Chicago. And that finger on the pulse that he had of those problems shaped the way he's approached the issues that he's confronted, not only with the sense of the real, but with the sense of what can be done and what the challenges are. Third, forget the job description. Do your job, but also look at ways in which the broader gaps in the environment in which you're working can be addressed in a fashion that enhances progress across the board. In my own experience, I think perhaps a lesson of that sort was in my mind when I ended up serendipitously, life is a bunch of serendipitous events, in a policy position in the Carter administration. And I was working with Joe Califano, who was a fairly flamboyant Secretary of Health, Education, and Welfare. And the first thing he did was say, go into the tobacco fields and visit with tobacco farmers and then lead this task force to change smoking profiles in the nation, which was set off a series of interesting challenges in itself. But then he said, immunization levels are too low. Let's set up a national immunization initiative. And then he said, sexually transmissible diseases are the scourge of our youth. And after a while, I was thinking, well, we can deal with this individually as we have to. or we can step back and take advantage of the science we've learned and develop a broader health promotion and prevention strategy. And because at that time, prevention was a fairly ethereal notion, and we had a clear opportunity not to just follow the job assignments, but to think a little more broadly. And my friend Bill Fagey and I partnered to begin that effort together. The next was don't count on things staying the same. Well, you know, that can be good and bad. You can be working along quite harmoniously and just assume that's the way it's going to go in perpetuity, and it's not. Or you can be confronting a real difficult challenge and assume that it's hopeless. It's never going to change. And again, I apologize for drawing on some of my own experiences, but there's one that I'll never forget in this respect. One of the things that fell into my bailiwick in this broader arena was nutrition. And so we developed these dietary guidelines, and USDA, theoretically our partner, was actually, during the Carter administration, a very solid partner to develop for the first time a common view across health and agriculture for nutrition directions. But these little simple, straightforward guidelines set off a firestorm among various quarters in the commercial sector, in a variety of sectors. In any event, the election occurred and a new administration was brought in literally 2 months after the dietary guidelines were issued. Jack Block, who was the incoming Secretary of Agriculture, came over and visited with us at the Health and Human Services Department with Dick Schweiker, who was then President Reagan's Secretary of Health and Human Services, and said, you know, this is really not going to work. USDA is totally against these guidelines. They don't have the science. They did. They don't have, they're against the economic welfare of many of the industries in our nation, and so on and so forth. And Dick Schweiker was great. He just said, my guys, it was about 40 years ago, 30 years ago, tell me that this is the right thing to do, so we're going to do it. Stuck with it. So we moved on with the dietary guidelines to again, jointly with USDA, to the next edition. So at the time of the rollout, I'm standing there with Jack Block at my side, and Jack Block holds up these two pictures. One of them is a picture of his prize bull when he is the head of in the 4-H in Iowa, or Illinois, I guess it was, which was this massive beast when he was a kid. And the other was the picture of his son's prize bull just a couple of years before, which was this lean machine. And he said, this is then, this is now, these are the right ways to go. So even though there's still many controversies and uncertainties that have to be resolved, things can change, and they can change in the right way with your involvement. Follow most, but not all of the rules. Well, I bet that, there's a lot of surprise at that. I bet none of you have ever broken the rules in anything you've been doing. But if by chance you happen to, it's very likely that you made a difference. And the watchword is not to break all the rules. The watchword is not to break most of the rules. The watchword is to carefully engage opportunity when it's the right thing to do. Like Denise and her toolkit, which is the right thing to do. Even though it may not fit the mold of every authority's view of what represents an organizational image. The fact is, it didn't stop her. She went right ahead, developed the toolkit, and it's going to be a big help for a lot of folks. It's a small example, but there are many. Actually, one of my favorite examples I'll take back to India again. Some of you may know Mary Guinan. Mary was a CDC epidemiologist, and she was working for me. I was heading Uttar Pradesh's program. And so one time she, at the end of at our monthly meeting of all the epidemiologists, she came and she gave me a voucher, for reimbursement. And the voucher was for an elephant. Because it had been the monsoon season, Mary needed to get to a reported outbreak. Everything was flooded, so she rented an elephant, which wasn't on our approval list. But the fact is, it got her where she needed to be, and it was the right thing to do. I'll run more quickly through the rest of these. Collect good data, even if you don't know what question they might answer down the line. And the fact is, again, in the smallpox arena, we collected a lot of data, and what they were really useful for was when the disease was eradicated and we were setting up surveillance systems. Those data were invaluable in charting the course. Remember your humanity. In this case, it's not just the notion of compassion, which we have because we are in the public health and primary care fields, but it's also your cool. To keep your head when there are all kinds of reasons that one shouldn't on the occasion, but it makes a difference to be level-headed. And I know Al, who has a little spark to him, Al found that self-restraint and that engagement with the fundamental needs of the moment to be in his tool chest, and a very useful tool. I remember when I was very young, in early adulthood, meeting Robert Kennedy. Serendipitously, I was with a friend, and of course, Robert Kennedy was an extraordinary man. He was a famous man, and one assumed that he was an unusual man, but the sense of compassion, of humanity that he exuded personally, and that he manifest as a small child walked by, and he turned and engaged, and had no reason to, because this was completely apart from the conversations that he was engaged in. It was a spontaneous act on his part, very simple. It was not what he did, it was what he shared, the example that he displayed, clear humanity and compassion that has stuck with me for a very long time. Use data to set policy. Data has coursed throughout this meeting. I'm not going to elaborate on that. It's very clear. If you think you're right, just keep pushing. Again, I'll draw on Bill Figge. Bill Figge went from Africa to India to take charge of the smallpox eradication program there. It took him a year sitting in New Delhi to convince the Indian government to give up a mass vaccination strategy and shift to search and containment. A year in which they said, no way, we are not ever going to do this. But they did. And within 18 months, the disease was eradicated. If you think you're right, keep pushing. And the last one, take the long view, is very clear. All of us in public health take the long view. It's vital. And it serves us well, and I know it will serve you well as you move forward. And I couldn't be more grateful, because I know that even though science and knowledge of the necessity and technology and funding and culture are not enough, that you are going to make a tremendous difference. Thank you all for what you do. Thank you for letting me be with you.